Continuing on from what Yvette was saying, we critiqued our chosen guideline according to the agreed to instrument. This tool rates the overall quality of the guideline according to 6 different categories, which assist in identifying the validity, reliability, clarity, clinical applicability, and flexibility of the clinical practice guideline. It also scrutinizes the guideline's compliance of scheduled reviews, development team, and implementation. Overall, we found that the NICE stroke rehabilitation clinical guideline is a relatively reliable source for provision of clinical recommendations on long-term rehabilitation for adults with communication difficulties after stroke. The good things about the guideline include that it clearly identifies the health intents, which are to review the structure, processes and interventions currently used in rehabilitation and to evaluate whether they improve outcomes for people with stroke by reviewing some of the available interventions that can be used in stroke rehabilitation. The guideline also clearly states the target population, appropriate age group, and also specifically mentions the excluded populations. The clinical practice guideline elaborately details the search findings and methods. Information was sourced from multiple databases, with clinical and economic searches also being performed. Study design search terms were also listed in the appendix, and all terms were put into a table, numbered and labelled according to study design research terms and grouped into the appropriate clinical databases. Searches were made using specific questions in a PICO format, and the appropriate Boolean operators were also applied. All names of the development group members were also clearly listed under the heading Guideline Development Group Members, and the group consisted of professionals from multiple disciplines, including speech and language pathologists, occupational therapists, and physiotherapists, which were all appropriate candidates for the development of the clinical practice guideline. Institutions were also labelled for all professional participants, and several method experts were listed as part of the National Clinical Guidelines Centre team members, including research scientists and health economists. Furthermore, a full list of recommendations is provided in the clinical guideline and clearly describes its intent, the targeted population, and relevant conditions to the suggested information. In terms of communication, the recommendations are rather generic, making it difficult for speech pathologists to apply them clinically. In addition, the guideline lacks information on how these recommendations can be implemented into practice. In the clinical practice guideline, only some recommendations list the facilitators to the application of recommendations. Not all barriers were mentioned, and furthermore, these are not clearly listed in a table and were not specific to each suggestion. The clinical practice guideline attempts to incorporate the public's view and preference, yet this is only executed through the inclusion of one patient and one carer member as part of the guideline development group. Input from only 2 participants would not be able to generalize the opinions of the wider population. And lastly, the clinical practice guideline states an update for the guideline would be warranted if there were major changes to the evidence. However, an explicit time frame as to when this would occur or the method for updating the clinical practice guideline was not outlined in the document. Now Nick will talk about the clinical guideline recommendations that our group would like to implement into practice.